Hi, my name is Mema Pasiting and today I am going to perform a return demonstration about the insertion of Foley catheter to my patient. Before I enter to my patient's room, I have to check first my patient chart. So my patient is Miss Jenny Smith. Her birthday is November 3, 1990 and she is 31 years old and bedridden for 3 years and unable to void 5 hours ago. That's so I was ordered to insert a Foley catheter for her in order to drain the urine from her bladder.
Now I am going to enter my patient's room. So I am preparing my equipment needed. Here is my improvised urine catheter, and here's my treat towelette for pericare, and here's my alcohol swabs, here's the lubricant spray, and here's the pad to provide more privacy to my patient, and here's my sterile gloves.
Well, now I have to perform the procedure, but first I am going to look for the expiration date of the catheter, and if the catheter is expired, I must not use it. So the catheter is not yet expired. Hi, Miss Smith. I'm Nurse Mema and I'm your nurse today. May I know your first and last name? When was your birthday? Okay, perfect. Let me ask you if when was the last time that you urinated? Oh, that was 5 hours ago. So, may I know if you have any allergies in shellfish, latex product, betadine or iodine? Since there is none, I am going to proceed to the procedure. So, let me explain to you what is a urine catheterization. That means I am going to insert a tube to your urethra to reach your bladder in order to drain the urine from your bladder. Is that good? Any question? Okay.
And since all the equipment needed was gathered, now I am going to position my patient in laparotomy position, the knees up and the legs separated. And now upon opening the urinary catheter, I must not touch the interior surface, and I make sure that I have done the hand hygiene.
So here, before to start the procedure, let's do hand hygiene. So I'm going to perform a pericare, which is to inspect and to cleanse. And here I have 3 towelette. It is to use the clitoris.
I am going to cleanse the clitoris to anus from top to bottom 3 times. And after using this towelette, well, discard the towelette. And the second, from top to bottom, from clitoris to anus, and discard. And the third one, from top to bottom again. Well, it's done. As you can see, I have already unboxed the catheter, and I'm going to wear my sterile gloves. I am wearing my sterile gloves to perform the next procedure, the insertion of catheter. Now I am done putting the sterile gloves, and I must not put down my hands below my waist. This will provide more privacy to my patient. So I have here the equipment. Here is my lubrication spray, and here is the 3 swab, alcohol swab. I'm gonna put this in here, and here's my lubrication spray. So I'm going to make sure that the syringe is safely attached to the catheter tube. So since it is improvised materials, let's assume that this thing is the 10 cc syringe contained with sterile water. So I'm going to unpack the sterile tube cover and put there. I make sure that the tube fits to the lubrication. So again, I'm going to check if the equipment is ready. So here's my 3 alcohol swab. Here is the tube and the syringe is safely attached. Now I'm gonna make my non-dominant hand contaminated to pull apart the labia. To cleanse the side, and after using this alcohol swab, then discard it. And the next side, discard. And this last one is to cleanse the clitoris from top to bottom. So before inserting the urinary catheter, I must assess the urinary meatus, and after I found it, I'm going to ask my patient to have a deep breath. Mrs. Smith, have a deep breath. I'm going to insert the tube. I keep on inserting the tube until I see some urine. And there, I see some urine flowing. After that, I'm going to insert the sterile water to the balloon port. After inserting the sterile water, I must attach the tube to the unmovable part. And let's assume that the tube of the urinary catheter is already attached to the unmovable plate, and the water is already inserted to the balloon port, and the water is already inflated. Now I'm going to make sure that the urine is already flowing to the urine bag, so I'm going to put the urine bag under the bed, and I must sure that it is safe and unmovable. And there I see some urine flowing to the bag. And now I am done inserting the urinary catheter, and I'm about to clean the work area. Going to remove this and this. I'm going to discard anything that I use, and remove my gloves. And the last thing that I must do before I leave is to do hand hygiene. Okay, Miss Smith, the procedure is done, and I am going to record. The insertion is already done, and as you can see, I have already cleaned the working place, and now I'm going to document the findings of my patient.